It's important to be part of a union because you have to have a voice.
Hi, everyone. Welcome to Union Talk. I'm AFT President and your host, Randi Weingarten. As some of you may know, we started these virtual town halls at the AFT when the pandemic started. It began as a way to keep in touch with our members during COVID when everything was shut down early in 2020. And it was a way of keeping connected in order to share information about the pandemic, answer questions our members had by bringing experts together as we navigated through the ever-changing virus, and also having a Tuesday every week or every other week that people could rely on as the AFT Town Hall. After well over a year of doing this, it's become a permanent fixture of our work here at the AFT. And this latest town hall was a huge hit, so I thought it would be good to share this as an episode of our podcast. Take a listen. Welcome, everyone, and thank you for joining us tonight. And we're a week out of Thanksgiving, and I really want to just, before I start, really just say blessings to everyone. It's been a very hard year, and there's a lot, I don't know about all of you, I feel like there's a lot that I feel that I am thankful for, including being alive at this moment in time. Mm-hmm. And I'm also grateful and thankful for the panel we're about to have. We have an Admiral, who also happens to be the chief nurse of the United States of America. I so love saying that. We have two parents who we work with very closely. One happens to be a teacher as well. Both of them are both teachers and parents. And we have also a teacher and parent who, if I remember correctly, I think your daughter just got married, Beth. Daughter or son or, someone I know just got married in your family. And Beth is a high school teacher and also the president of the Massachusetts Federation of Teachers. And so today, the next 45 minutes is all about vaccines. And we really wanted to have a conversation now that vaccines for 5 to 12-year-olds have emergency use authorization, at least the Pfizer ones do. And as we have in every one of our town halls, we really want to make sure that we have experts, we have parents, we have teachers. We really see the question about, vaccines for kids from all sorts of different perspectives and to really kind of dig down into, how people made the decision, why we think that vaccines are safe and effective, and frankly, what the next steps are, assuming we can get lots and lots of kids vaccinated. So, there's 28 million kids in the United States between age 5 and 11 who now have an opportunity to get vaccinated. And frankly, in the first week of emergency use vaccinations, nearly 1 million kids under the age of 12 got their first shot in the first week. Vaccines were available. There's 195 million Americans who are fully vaccinated now. And this may be the way that we, the game changer, like it has been the game changer for us being able to reopen schools and keep them open. Now, it's not perfect. I had a great conversation with folks in Lynn about, the ups and downs about back to school this year. And we know the layered mitigation works, but frankly, parents are wondering, as are teachers, what are the metrics? When can we get rid of these damn masks? We know that they work, but what can we do? What's the metrics? What happens next? So ultimately, we want to ask the experts what to do. And Massachusetts, which is one of the reasons that Beth is on, just announced a very interesting way of both incentivizing and keeping kids safe by saying that in schools where 80% of the school community, both adults and kids, are vaccinated, then the mask mandate, then the mask mandate is waived. And so, we wanted to ask Beth what she thought about that, and does she think that that's a good idea? And we also really wanted to talk to Colleen and Veronica. Colleen, her 12-year-old daughter is fully vaccinated. Her 8-year-old son had his first shot. And, we wanted to ask her, okay, how'd you make that decision? What went through your mind? What did you do? And, Veronica also, the kind of outreach that the union is doing. So that's who's up today. And, but we are going to start with our expert. As I often say, I am not a scientist. I don't even play one on TV. I am a teacher, social studies teacher, and a lawyer. And so, we always look to and listen to the scientists and the experts about what the science is here. And so Admiral Mix, in addition to being the nation's chief nurse officer, Admiral Mix is the United States representative to the World Health Assembly in Geneva, where she serves on the International Council of Nurses, the government chief nurse and midwifery officers. She's also the senior advisor to the U.S. Minority Officers Liaison Council. And, as the union that represents over 200,000 nurses, and we're so glad we just settled the contract in Kaiser. And we know what our nurses have gone through this year, frontline healthcare practitioners. Your 25 years of experience in nursing as a clinician, as a public health practitioner, as an educator, as an emergency manager. So it's more for everybody who's watching that then, in addition to being the highest ranking professional nurse in the United States of America, she's with us tonight to talk about these things. So thank you, Admiral.
Absolutely. Thank you so much, Randi. Good evening to everyone. Definitely thank you for the opportunity to join all of you tonight, especially for this important discussion. I do bring you greetings on behalf of our Assistant Secretary for Health, Admiral Rachel Levine, as well as our Surgeon General, Vice Admiral Vivek Murthy, and the nearly 6,000 active duty and reserve public health service officers that are serving across the globe. As you've mentioned, our public health nurses certainly have played a tremendous role in this COVID-19 response effort over the past 18 months. And truly, the nation has experienced significant change. We've been challenged, certainly. Many of us have experienced great loss, whether it's indirectly or directly. And at the same time, though, we've had to get back to basics as it relates to our connection with family, with friends, the communities we live in. We've gotten back to the basics of really focusing on how to get and remain healthy. And if nothing else, what we've realized at this point is it's really going to take all of us. It's all of our responsibilities together to achieve it. So I do look forward to our discussion today because public health, and especially as it relates to public health nursing, of which our school nurses are a part of our public health nursing force, we always build off of the basics, and certainly in an effort to protect, promote, and advance the health and safety of our nation. So I'm really, really happy to be here and talk with you all this evening.
We're going to get to questions in a little while. I'm going to introduce Beth. She's the AFT Massachusetts president since 2018. It does feel, because of COVID, Beth, like we've been in these jobs for an eternity. But she's also been teacher in Salem, Massachusetts for 14 years before that. And, really engaged in all the work that we do, a vice president of the FL-CIO, a vice president of the Central Labor Council, and any issue that requires somebody who cares, fights, and shows up, you're going to see Beth on that picket line or that food pantry. That's who she is. So, Beth, tell us a little bit about, this Massachusetts plan and also the kind of rollout of vaccines in Massachusetts.
Sure. Well, thanks, Randi. It's so great to be here. I'm honored. In Massachusetts, we had a very, very busy summer planning all our back to school events with book and school supply giveaways, with the real focus being vaccines as an option, right? To get our older students ages 12 and up vaccinated. And of course, we had some staff that hadn't been vaccinated yet that were vaccinated at these events, and we had adults from the communities. And in Lynn, for example, we had a mother and a child get vaccinated together, and it was quite heartwarming to see that become, a family event. So we use the back to school fairs as opportunities to celebrate being back together, but also to share that message of safety through mask wearing, good hygiene, and vaccines as a way to keep us together in the long run. And I think we laid a good foundation. We had fun and we had some success with the vaccines, but we put it in the heads of all the kids that when it's your turn, when there's vaccines for the younger ones, please, let's get your families back out here again. And in recent weeks, we have seen a rise in COVID cases in our schools among our students and with our adults being close contacts. And we've had some disruptions. This has increased the urgency to get vaccines out to our youngest children. And now our communities are really embracing the vaccine rollout for the younger students. And today it was announced that we can have booster shots for all adults. So we are encouraging our members and our families to get the boosters. One statistic I think you might like to hear, that Boston has had 60 clinics so far this year for ages 12 and up. And they're already opening clinics in some of our elementary schools. And the goal is to have a vaccine clinic in every elementary school as soon as possible. Lynn's been giving out vaccines this week and in the elementaries, and they've actually had more people show up for vaccines than they've had pediatric doses. So we're going to be pressuring the governor to be sure that we have more and more doses available. And our families are going to the clinics. They're going to their pediatrician's office and the pharmacies in the community. But we really want doses to be available in the schools because that's where our kids are every day, right? In Lawrence is rolling out. They have vaccine hubs happening in schools from 2 to 6 p.m. every day with written consent, of course, but it doesn't always have to be just the parent. They're allowing more flexibility. So another adult could bring the child, a family member, not just the parent. And this is key, Randi. Information about the vaccines is being distributed in multiple languages in Massachusetts, and our community is being informed that absolutely everyone is welcome, regardless of immigration status or healthcare coverage. We really are making it clear, that we want all students to have access to the vaccine, and we desperately want a school year with as few interruptions as possible. And we know that vaccines are truly the way to do that and to combat this virus and create a new normal in our schools.
Great. Thank you, Beth.
Sure.
And I want to also, and I'm dying to ask Admiral Mix this question about how we combat misinformation and things like that. But I want to ask the two parents that we have here. Parents have to be our partners. And so many, there's a little controversy as I say this, since there was a particular senator that tried to take me on because I don't have children by birth. I have stepchildren and step-grandchildren and lots of nieces and nephews. And, there's people who attempt to divide parents and teachers. And so many teachers are parents, but we take care of other people's children all the time. I mean, that's our job. And parents rely on us to do that. And so, but we have to be intentional about making sure that we recreate the trust, the relationships that, look, COVID has fractured some of them. And so it's so good to hear from first Colleen and then Veronica in terms of, Colleen is the first vice president of the Lynn, Massachusetts Teachers Union. She's a reading specialist and she's a mom. And I'm really so grateful that you're willing to share with, the people who are watching this, an intimate little group about, what went into your decision to get your kids vaccinated. And then right after Colleen, I just want Veronica to talk about the outreach efforts, because Socorro, Texas, the outreach efforts, just like Beth was talking about, it's pretty awesome in terms of you have to create the trust on the ground. And the union is really key to doing that. And you're the first vice president of your local. And frankly, I started as a, teacher local in New York City. It's really different to be a local union in Socorro, Texas. And it takes a lot more to do that in terms of building that community. And Veronica, I know how much you've done. So I kind of want both of you to talk, and first Colleen, and then Veronica, and then Admiral. I'm going to ask you the first question.
Hi, Randi.
Hey, Colleen.
So I am the parent of 2 children. I have a daughter who's 12 and my son is 8 years old. And actually tonight is the eve before he gets his first vaccine. So we've been talking about it now for a week, and he is very excited about doing this. He knows that everybody that isn't a grown-up around him has been vaccinated, and it's been a lot of talk. My husband and I have already had our boosters. So he knows it's his turn now to be safe. He knows that he needs to protect himself. It will make his school a safer place, and he'll be able to have safe interactions with older family members. He also knows that his mother may let him go on a play date if he's vaccinated. But he's thrilled about going to CVS tomorrow after school to get his first vaccine so that he can become a COVID crusader like everybody else. A little bit of background about my family is last Christmas, we had COVID for Christmas. My husband, myself, and my son all tested positive. My daughter had to live with us and she was negative. My son had no symptoms whatsoever, but my husband and I were sick. Because my son was positive but had no symptoms, it has stuck with us for the whole year. Anybody around us that appears to be okay could actually have the virus. So it's put us on alert, and it's kept us away from crowds. It's kept us from really living our normal life. So we're hoping that with all of us vaccinated, we can consider going back to a relatively normal life. Part of what influenced us to get vaccinated after getting COVID-19 is that my sister is actually a nurse at the major hospital in Boston. And anytime I have a sniffle, a scrape, anything, I always pick up the phone and I talk to her and, what should I do next? COVID came and there was regular dialogue all the time. Well, what's going on at your hospital? What's going on here? What should I do? And, it's very clear from the medical community. I trust my sister as a medical professional. And she said to get vaccinated. I spoke to my doctor. My doctor said we must get vaccinated, and my children's pediatrician. And those are people that I trust. They have been involved in my medical history. And this is what they've said. So we knew that this was what we did have to do. Something very exciting happened at school yesterday. Lynn started their vaccine clinic yesterday. We had 2 kids that got vaccinated in the middle of the school day, came back to school, lifted their arms and showed me their Band-Aids. And that was exciting, but not as exciting as today. When I was in 4th grade, it was 1st grade. I was teaching my 1st grade. And one kid came and showed me their Band-Aid. And I said, oh my gosh, you got vaccinated. How exciting. But there were 4 in the class that had Band-Aids. They were all showing me their Band-Aids. There were only 16 kids in the class. That's 25% of the class that was vaccinated in one day. So it was very exciting. But I feel like as educators, if we can make a big deal about this for them, then it might get other kids pressuring their parents into vaccinating them. Our school district has sent out emails, all calls, and text messaging explaining where the vaccine clinics are in the city, the times that they are. They're free. They're not going to ask you for identification, and really encouraging parents to please just go and get vaccinated. So That's my story about vaccinating. I don't like to talk to other parents about vaccinating their children because I feel like there's only one right answer. It's not a discussion we're going to have. You're doing it and you're doing the right thing, or you're not doing it. I share with everybody, I'm vaccinated. My child is vaccinated. My other one is getting vaccinated. But there's not going to be a dialogue with me about why you're choosing not to vaccinate your child, because I am going to walk away. I feel it's just very important that we do this.
I think everyone, and then I want to go to Veronica. I think, there is, and because of all the misinformation, there is a lot of hesitancy. And I mean, we all have our different ways of dealing, but I do think that finding a way to create the kind of trusting relationships so that people hear each other is really important. And the fact that you have so much excitement in your class, 25% of kids that, just show the Band-Aids and, they're okay. And they feel like, a vaccine crusader, and making it fun and joyful is really fabulous. It's probably why you are such a great teacher. So thank you, Colleen. Veronica.
Well, good evening, Madam President, esteemed panelists. Thank you so much for this amazing opportunity. I'm an educator, parent. I'm also, part of our Socorro AFT local 6427. And for those of you who are not familiar with where our local is, it's in El Paso. And it's on the far east side of town. And we have most of the schools in Socorro Independent School District are Title I schools. Just to give you a couple numbers, 49 campuses, 47,629 students, 92% of our students in our district are Hispanic. 73.5% of the students are economically disadvantaged. So to say the very least, we do have a lot of hurdles and obstacles when it comes to vaccination and educating our community. But as a parent, I can tell you of an 11-year-old with underlying medical, health conditions. Last week, he got his first vaccine. I was so excited. It was actually at one of our locals, vaccine and free books events. So I'm filled with immense gratitude to First Book and our locals president, Veronica Hernandez, and amazing staff there at Socorro AFT for partnering with not only the city Immunize El Paso, but partnering with the interim superintendent of Socorro, Dr. Martha Carmona, and actually putting these wonderful events together. The goal is to use our First Book distribution events in order to motivate as many vaccination opportunities as possible to our community. And when we were there at one of the events just last week, it was just amazing. Usually when you enter vaccination events, you hear cries, the little ones are crying. And no, they were just so happy because they knew, oh, I'm going to be brave because once I show my Band-Aid, I'm going to get those free books. It was just such an amazing event and everyone was so grateful. It was a positive spin. The line for the community was out the door at the event. Not only were vaccinations available to our 5 to 11-year-olds, but it was available for adults to get their boosters or anyone who needed it. Flu shots, which is really a big thing right now. We're in flu season. So it was such an amazing event. Just to give you a little bit of information, 3,600 students have been vaccinated so far at these wonderful events that Socorro AFT and our partners have actually put together. The first round just ended this Tuesday, and the second round is about to begin in December. So 30 of the 49 campuses at a minimum are actually going to be receiving books, free books. And today, Socorro AFT has actually given books to 22 schools, over 20,000 books to SISD students and the community. And overall, we have had actually over 220,000 first books given away to students in our district and our community. So doing this, we actually continue to work in getting back to school as safe as possible in the midst of the COVID pandemic. And as a parent and educator, it's just a relief to see that there is a light at the end of the tunnel.
Thank you, Veronica. And for the people who are listening, and I'm going to go to the Admiral in a second, what Veronica is talking about in terms of First Book is that, we've had this relationship with a group, a not-for-profit, who can get books from publishers at really, really, really cut rates. And we have now, that's First Book, with First Book, given out over 10 years, 7.5 million books. It's part of what we do. It's part of, this is union dues that are going to this, just like teachers dig deep into their pockets to buy supplies for their kids. But what Veronica is talking about, and Lynn did this too, and Beth talked about this as well, and I'm telling the Admiral this as I'm telling everyone else, we did a $5 million grant. We took all the money that we didn't spend in travel last year because of COVID. We took all that money, $5 million, and we put it out to our locals as a grant to help with back to school efforts, back to school for all, including these kind of fairs, these kind of standing up vaccine clinics, the having the care closets or books available for kids to be able to read. And, what's happening is that Lynn and Socorro are continuing this work for vaccinating kids. And that's what we're going to, and here's spoiler alert, we're about to be rolling out something really big using First Book and other things and other entities. I won't rain on my own parade here about literacy and reading in the next couple of weeks. So stay tuned. We know that this is really important and really important during the holidays. But getting back to vaccines, there's been a ton of questions on Facebook already, Admiral, and I wanted to ask you two of them quickly. One is, people wonder, are kids getting the same dose, or 5-year-olds getting the same dose as adults got? So instead of me answering it, since we have you here, I figured I'd throw that to you, and then I want to throw the misinformation question out to you.
Got it. The answer is no, it is not the same dose. In much the same way that many of the medications that are available are dosed specifically for children based on age and weight, it's the same thing for the vaccines. And so when children present, and that's why in some places they do have vaccine availability for children and some may not have as much, it's because they absolutely have to have the accurate dose for the age group that they're actually providing the vaccination for.
There were a lot of trials about really trying to figure out exactly what the right dose was, right?
Correct. That is absolutely correct. As many people have followed, and that's part of a lot of the conversations that many people don't realize, is that before the vaccine could be approved for emergency use for this age group, it absolutely had to be tested. And so there were many kids that were involved in that testing. And so what they studied is looking at the impact, the results, the outcomes, and the effects that the children had after receiving the vaccination. And so in looking at how children fared after this, it's not until they actually were able to identify that it was safe that it was able to be released for emergency use. So you're absolutely correct. There were many, many trials in order to come to this point.
Oh, as there should be, because our kids are our most precious resource, which is part of the reason it took a much longer time in terms of making sure that vaccines were safe for kids. So that gets us to the question that, we see all the time, which is misinformation and disinformation. And, the question I have for you, Colleen answered it in some ways in the way she does this, in terms of just not to engage in the conversation once she sees what's about to happen. But what do we do about all the misinformation and the disinformation? What's your advice as to how we should deal with this? And should we confront it? Should we ignore it? Should we, as educators, try to educate? Should we have fact sheets out there? Give us some of your advice about what, we should do as educators, to deal with all this, and frankly, as healthcare workers, as I said, we're the second largest nurse union now. what do we do about this misinformation? How do we deal with it, and how do we move past it?
Got it. And that is really a great and a timely question. And I think first and foremost, you mentioned when we first started the number of children who've been actually vaccinated so far against COVID-19. And I can say that even after 2 weeks, what we've seen is nearly 10% of all children that were eligible to receive the vaccination, the COVID-19 vaccination, have been vaccinated. So first things first is continue to celebrate the wins, continue to generate the excitement. The things that Colleen mentioned and the way that the kids are so excited to be vaccinated, continue to support that first and foremost, right? I think we do tend to get bogged down and we get really upset and disappointed when people are not understanding or there's misinformation. But I think spreading joy and happiness is often a lot easier than trying to reverse some of the pain, right? So specifically, as far as some of the things that we can all do to address health and misinformation, the Surgeon General actually released a toolkit recently. And that toolkit is written for every member of the community. So that includes teachers, that includes healthcare professionals, that includes religious leaders, that includes, community organizations. And so some of the things that it points to is really, how do you approach this in a way that you're not kind of escalating the situation? So first and foremost, and I say this to everyone anytime I'm having a conversation, is you have to know yourself first, right? You've got to take the time to actually commit to educating yourself and learning about COVID-19 vaccine options in and of themselves, right? So before you can ever engage with anyone related to their information or misinformation, you first have to know it for yourself. Be honest with yourself. Acknowledge your own questions, hesitations, gaps in knowledge that you might have. I share my personal story. I was not one of the first people to get a COVID-19 vaccination when it was available to adults. Why? As a Black woman, I've got a whole lot in my head about, vaccines, trials, research, and people and how it's impacted my community. I had my own family members who were asking me questions that I couldn't actually answer. So I had to take the time that I needed, even as chief nurse, to make sure that I understood it in a way that, not only did I feel comfortable, but I could actually communicate it to others confidently, right? So once you've had a chance to really understand and educate yourself, the next thing you've got to do is really take the time to listen and empathize with others. It's very important that you acknowledge the concerns, and many of them are, frankly, coming from an area of fear that people still have about COVID-19. We've been in this fight for over a year. And so people still don't necessarily understand the virus well, let alone the vaccines. So you've got to give permission for people to really feel what they feel. And that's really the way to open up the dialogue. Understand where the concerns and beliefs originate, right? Not everybody is coming from the same place, and not every reason for not being vaccinated or not having your child vaccinated is the same. So as I said, I've opened up discussions using personal experiences. Again, recognizing that if I couldn't make heads or tails of it initially, I certainly have to give grace for others that may need additional time to do that, right? The next thing that's important to do, so you know yourself, you listen, you empathize, and then you help direct them and help present to them credible sources, right? Because that's the other area of misinformation, because people don't necessarily know where to go for information, right? If you've been in an academic arena, you're well-versed in, researching and all that kind of good stuff. You know what a credible source is, you know what is a little outlandish. Not everyone has that same basic knowledge, right? So you've got to make sure that you are meeting people where they are and presenting it in a way that they can understand and with information that relates to their actual concern. Sometimes it's actually, sitting down with someone, hearing what they have to say and understanding what's causing it. But other times it truly is that you've identified, a lack of knowledge or a lack of understanding. The worst thing that you can do is just constantly throw resources at people, right? If they wanted to read it, they probably would have already read it. So you've got to actually engage them to understand so that you know which resources are actually going to be impactful. I think this is important when you consider conversations with your students, as well as with the families, because what you dialogue and what you share with the children and the students and their families is oftentimes going to be different than what you're sharing with your colleagues and with your friends who might have a different starting place for what they understand. The next thing that's important to consider is that you should never publicly shame anybody. It will get you nowhere, right? And so this goes for personal conversations as well as social media. It's very hard. Believe me, it's very hard sometimes to sit on your hands and kind of watch the conversation unfold. But you really have to take the time to really figure out, is this the time? Is this the place? And is anything that I have to say in this moment actually going to be impactful? And more often than not, in social media and even personally, when you feel that itch that you absolutely have to say something, that's usually the time where it's probably best to not, right? Take a moment, walk away, and then figure out really what you want the outcome to be so you can make sure that your action actually aligns to that. As a nurse, for me, one foundational belief is that, everyone is entitled to their beliefs, right? And they also should be empowered to make the best decision that is for them and for their loved ones. And, as I was listening, because Colleen was sharing, when you're hearing something and it immediately sounds completely wrong to you, right? Know that that person who is expressing themselves feels that everything you have to say is just as completely wrong. And so it becomes a battle of, what is right. And I think the biggest takeaway that, I will share for all of you is that, when it comes to a right decision, it has to be that person's decision because they're going to make the decision that they feel is right. What you can do, though, is assist them in making sure that their decision is an informed one, right? You can actually have a conversation that says, okay, got it. Whatever the decision it is, it's yours to make. I'm not going to tell you what to do, but let me help you make sure that you have the answers to your questions and you have the accurate information, because what I heard you say is a little bit different than what I understand it to be. Let's talk about what you just said. So it takes the focus away from the decision and, that right versus wrong battle, and it allows them to have all the information that they need. Now, this is the hardest part, right? You might provide all of that and they still might not make the decision that you'd like them to make. It will happen. It will happen. And we all have to be okay with that, right? But ultimately, as I said before, we're all in this together. And that is absolutely the only way that we're going to continue to make it through and begin talking on the other side of this pandemic about how we made it through the pandemic. But this first step of really, mobilizing the youth and getting the youth vaccinated, creating these youth forces, as I mentioned, is really a great step. And I think it's important to recognize that you all that are represented by the Federation, you are a trusted source in your community, right? And know that even when people pretend that they're not listening and they're not hearing, they're actually watching and they are listening and they want to see what you're going to do. So be sure that your actions follow your words and that they align with integrity. Because ultimately, when it's all said and done, people are going to trust you. They're going to continue to trust you. In fact, they trust you with some of their most precious things on earth, which are their children. So again, just in a recap, know for yourself what the truth is, right? Listen and empathize. Don't publicly shame. Provide the accurate information when you can, and also use inclusive language to let them know that we're in it together. And again, just to, add, the Surgeon General's toolkit certainly is available on our website. And he's been on, talking about it on Twitter and a lot of other areas. But I highly recommend that folks download that and use some of those fact sheets as well as the specific tools to help guide you in this area also.
You answered most of my questions that I was about to throw at you, with the exception of one, which, again, because I'm getting it on Facebook. Look, we do this in a very open way, and there are people who are against vaccines who are on Facebook right now. And so I just want to throw out one of the questions that they would ask, or they have asked, and I've gotten this thrown at me a lot too, which is, and you probably even, exactly the one I'm talking about, which is, I had COVID. Don't I have the immunity? Why isn't that immunity better than the vaccine? I'm not quite sure how that question kind of relates to all the kids right now, except we've had a lot of kids who, have had, and with the Delta variant, a lot more kids than we've had before who have gotten COVID. But that's the question that's now on our Facebook page. So I'm going to throw it right at you, Admiral.
Yeah, and that's a real question. That's a very real and a very valid question. And I think it's a two-part answer, right? So the first one is making sure that people are aware of, how the vaccine works, right? The vaccine does not serve as like a force field protector that is going to absolutely prevent people from, having COVID-19, right? So it's not going to be kind of a force field against the virus.
It's not Star Wars.
Right. So that's very important for people to realize. Yes, it is possible to test positive for COVID-19, even if you've been vaccinated. The purpose and the intent of the vaccination, though, is to help you make it through that experience, right? And so it's going to decrease the likelihood that you will experience a hospitalization or a severe illness or even a death, unfortunately. And so it's a level of protection that you have that's been tested and proven that you would not have if you had not been vaccinated. So the second half of that answer relates to, well, if I've already had COVID, don't I have the antibodies, to protect me, for the rest of my life, basically is what people are saying. The answer is not really, right? There is not a way for us to measure the level of antibodies in your body to compare it to what's needed in order to protect you at the same level of the vaccine. The vaccine, though, has been tested and it has been shown based on the dosage to provide the appropriate level of protection. So when we have the conversation about boosters, as the studies unfold and more information is available, we know more, right? And so, my mother used to always say, when you know better, you do better. Same conversation for us across the nation, right? As we learned how long our protection exists following the initial vaccine completed series, we recognize and realize that a booster would actually help us. So if you've had COVID and you may have antibodies, there is not a way for us to tell you that that level of antibodies that you have is significant enough to protect you. There's also differences based on your experience, whether you had a severe case of the COVID-19 illness or not. That also makes a difference in the antibodies. So it's really not as easy as saying, if I've got it, then I'm okay.
Thank you so much. And can I take you everywhere to answer questions? And
I wish.
Thank you. So I want to just kind of end with a question for Beth and a question for Colleen and a question for Veronica on what it's been like this year. I mean, Beth, you and I we're just on a PPC meeting this week. The AFT is going to have 2 shortage task forces, one for educators, including support staff, one for nurses and healthcare professionals, because of how much has affected them this year and what do we need to do to address and alleviate well-being and all these shortages in schools. But part and parcel of that is we call this moment the Great Exhaustion, that it feels in November like it's June already. I would actually say it felt in September like it was June already. And so the pandemic has really been hard on the physical and the mental health of our members and of kids. There are several districts who are kind of extending Thanksgiving holiday next week to create some mental health days. So, from your perspective, what can districts do and parents do to support educators? What can educators do to support each other? And, Veronica, I'm going to ask you that same question because you've seen it from the parent vantage point. So I'm going to ask you that same question. And Colleen, because, Lynn has been so amazing in terms of its solution-driven way of opening schools and keeping them open and everyone working together. I'm going to ask you and then Admiral Mix to have the kind of last word on this.
It's a big question, Randi. Education is extremely rewarding as a career, but it's also very, very demanding, right? And we spend so much of our time thinking about planning for our days in the classroom when we're not in the classroom, right? Nights and weekends. And for many of us, it's difficult to turn that off. And that certainly has been compounded by the stress and fatigue that comes from being concerned for our students and our coworkers through this pandemic, right? So It's been a very difficult couple of years. This is our third school year with COVID as part of it, right? So, and some of our schools have done some exactly what you said, like given an unexpected work from home day when it was supposed to be a professional development day, but they allowed people to do it remotely. So you can be in your slippers, I mean, that feels really nice. You still do the work and have the camaraderie with your coworkers, but you get to do it from home. Another school system added a day off after Veterans Day. Like you said, some others are extending the vacation break so that we have just a little extra time to decompress and to have time with our own families, with leisure activities, which are important for all of us. But we are also encouraging our educators to put limits on their evening availability, right? Like, don't check your work email at night. Get exercise, eat well. Those are all things that we want to tell our children to do throughout their lives. So we tell it to ourselves and our coworkers. But here's the point. Educators have always been asked to do too much and care for too many of our society's problems. And I believe calling it a burnout is a little incorrect. It's a misnomer. It's more like being demoralized, right? We've been demoralized in the press, in social media. We've been blamed for all kinds of things. But we see what our students need every day, and we want to help those students. We don't always have the resources to do it, right? We need counselors and librarians and art teachers to help our students process their feelings and create connections with each other. And right now, we have a chance to do all those things that we've been missing out on. And some of our school districts have been becoming more and more interested in offering services like a community school model that we've been doing a lot of work on, and offering counseling and medical services for students, and more meals and supports in and out of the classroom for the entire family. We need to hire additional passionate people to work in our schools to offer these services. So this is some of what our recovery money can go to, resources to round out what we can do as educators, right? And bring hope back into our schools, the hope that we really can make a difference and help our students become their best selves. And that takes resources, and I'm forever grateful for all the work that's gone into getting us resources. So I think that's how we avoid the burnout and transform demoralization into opportunities for success for our students and our educators, because we're all in that classroom. It's our work environment, it's their learning environment, and we need to just keep plugging and take care of each other.
Thank you. Thank you, Beth.
Mm-hmm.
Veronica.
That is a great question. There's a lot going on that question. So first, as a parent, from the parent side, thinking as a parent, just speaking to the educators. I'm an educator myself, but just kind of wanted to break it down. As a parent, just continue doing what you're doing in the classroom as educators, making sure that you're reinforcing that positivity. Some students are wearing masks and some students aren't. Just make sure that, it's a nice, wonderful, safe environment, that if my child does want, or any child wanted to wear a mask for whatever needs that they might be going through, they feel that they can, and then they're not going to be shamed for doing this or doing that. Just reinforcing that wonderful, positive learning environment. Speaking from an educator's perspective, if parents would just be a little patient with us. This year, it is a lot. There are numbers, huge numbers coming back into the classroom, which is amazing. We are coming out of, just learning on a computer, and that's not working. And parents are realize that through experience. And so now that we have all these kids in the classroom, just as parents, speaking to us educators, please make sure that you're patient with us. We do have the best interest of your child at heart. We're taking care of all your little ones and your big ones. Just be on the same page. Help us help them. And I think that's the best advice that I can give from both perspectives.
Thank you, Veronica. And for those who don't know, look, we're nationwide. So we have some states that have mask mandates, and we have some states that oppose mask mandates, and school districts have been doing it anyway. So, we're all talking from our lived experience. Colleen.
I feel like many of our students, they have a lot of stress at home that may be something as part of COVID, but also as educators, we have a lot of stress too that is coming from upper administration. And so these kids are getting stress from their parents at home. They may be getting that stress that the educators don't really want to share with their kids, but it sometimes comes through. And I think that we always need to be aware of that. And I know that my coworkers are aware of that, but we always need to make sure that we're more calm and more patient. Everything seems to be taking longer because our students haven't been in school for a year. They've missed that whole year of how to do school. And we're in this retraining phase now of how to do school and the procedures on how to walk into a classroom, empty your backpack and get your before school work and get ready to work. And what does that look like? It just seems like they just need more time for that. So I feel like we just need to give our students more time and be more patient with them. And we need to celebrate all the exciting things like getting vaccinated. And I am noticing now we've done our beginning of the year testing with students, and their reading scores weren't that high. Some of them were really low, but they've been in school for a few weeks now, a couple of months, and we're starting to see some big gains because they've been in school every single day and they're getting it. And there is a lot of little things there to celebrate too. Yeah. We're seeing bigger gains than we did last year because our students were at home learning. So it's about being patient, giving people the time they need, and celebrating what we've got to celebrate.
So as I end, and I want to Admiral Mix to have the last word. I want to tell all of you about the school visit that I had today. As many of you know, I'm in schools a lot. And since April 1st, I think I'm between 55 and 60 schools that I've been at. But today, and also last week, I was at a school last week, New Lexington, Ohio, that has a working barn. It's a really small school district in rural Ohio. Poor county. They have a working barn. It may be they may have the largest group of future farmers of America in the whole country. And I watch kids. They have corn on the farm. And so they had, ears that were not, harvested, and they made them into popcorn. I have no idea how they took the, ear and they made it ready for popcorn, but they did. And they put them in separate little packages. And I watched those kids, those kindergarten kids, eyes wide open like mine right now, getting one of those things so that they can make popcorn at home. You would not have known that they've had 2 years of COVID. And then fast forward, that's rural America. Fast forward to today, Kimball Elementary School in Washington, D.C., urban Washington, D.C. They have a kitchen, a working kitchen that is one of their electives, and a garden. And these were 4th and 5th graders. And they took the sweet potato. They farmed it from the garden. I did it with them. Congressman Bowman did it with them. They farmed it from the garden. They cooked it. They used it and other vegetables that they also farmed to make quesadillas. And this school, they never have salad left for lunch because the kids are eating healthy food, many of which they cook themselves. This is the promise and potential of public education. I'm talking about food as we're getting close to Thanksgiving, but Admiral Mick started us about joy, and Colleen about the celebrations, Veronica about First Book. We're all smiling. This is, as my staff was saying as they were showing me the Facebook post, this is the first that couple that we're all smiling the whole time. So Admiral, chief nurse of all of us, give us some parting words about how we kind of move through vaccination and keep ourselves and our kids healthy as we kind of get through the next few weeks.
Yeah. And, listening to each of you, I think, what's important for everyone to realize is, who we are, each of us, whether we're talking about students, families, our educators. It's a combination of where we live, work, play, pray, and especially where we learn, right? That impacts so much. And we've got to make sure that we continue to take that in consideration. I leave you with a charge for each of you, that are listening online as well. Be in action in any way that you can, right? In order to identify and address some of these systemic barriers that we've talked about that are actually in the way of people having their children vaccinated, because sometimes there is a desire, but there is not an opportunity for access. There's not transportation. There's not time off for work. So do what you can to ensure that people have those, at least the systemic barriers out of the way. Then it's a look at the infrastructure, just like I said, supporting colleagues. And then what's even more important, though, is on an individual level. We've talked a lot about the physical impacts of COVID-19 pandemic. The mental and emotional impact is significant. As educators, I'm a mother of 4 daughters, one who completed half of her junior year and her entire senior year virtually. Missed out on graduation and prom and all those things that she had been looking forward to as her senior year. Same thing for my senior who graduated from college last year. We've had to really embrace this new way of life, but some of the mental challenges and the emotional toll, we also had to pause. And so I invite all of you to also pause. Remember that you cannot take care of anyone if you do not take care of yourself. Please, please, please continue to place yourself first. Make sure that you're filling your cup and then sharing with others from the overflow, because if you continue trying to pour out of your cup as you're trying to fill it, you will never feel fulfilled, right? So as we approach the holiday season, and especially as we approach next week and Thanksgiving, and an opportunity to give thanks for all that we've got, take a moment, celebrate yourself. We've got plenty of time to worry about everyone else. Take care of yourselves, really and truly, mentally and physically. And again, I really do appreciate the time here with you all tonight. And I do hope you take my words to heart. And even when we log off tonight, go do something special for yourself and enjoy your Thanksgiving.
And with that, no truer words. Take care, everybody. Have some grace. Have a good Thanksgiving. Thank you, Admiral. Thank you, Beth. Thank you, Colleen. Thank you, Veronica. And this ends this town hall on children's vaccines. I hope you enjoyed this episode of Union Talk. Remember to subscribe wherever you listen to your podcast and tune in every other week for a new episode. Thank you, be safe, and be well.